Angela Alsobrooks confronted Robert F. Kennedy Jr. about whether the nation's top health official fully understands the agency he leads at a moment when public trust in government health policy is already fragile.
The Safe to Sleep campaign. Well, then can you name, sir, which office the Safe to Sleep campaign operates out of?
Which campaign?
That prevents babies from dying in their sleep. A 30-year program inside your agency. You would agree that it's
I
important.
think it's part of HRSA. Or ACF, it's ACF.
No, actually, it's in Health and Human Services.
Yep.
And I think, and again,
No, they're all within Health and Human Services, but the subdivision is ACF.
no, actually, the name of the office.
Administration of Children and Families.
No, let me tell you what it is. The National Institute of Child Health and Human Development. This is actually the one that your aunt, Eunice Kennedy Shriver, is the person who it's named after. Although this is a very important agency, prevents babies from dying, this is the same one you fired every single person in this office as of April the 1st. Well, then the question also is, in addition to firing the individuals who make sure babies don't die in their sleep, why did you cut funding and staff from the CDC's National Center on Birth Defects and Developmental Disabilities, which supports the Special Olympics? Was that a mistake? I've heard you say you've made some mistakes today. Was that also a mistake?
We switched those programs to the Administration for Healthy America. They have not been cut.
Well, the funding has been cut. What does the assisted reproductive technology mean to you? Are you familiar with that?
Are you talking about IVF?
Well, it's assisted reproductive technology. It's a division. Do you know what it does?
Is it part of NIH?
No, it's actually a part of your agency. It's a
Oh,
part,
NIH is part of my agency, Senator. You should know that.
I do know that, but it's actually a part of, it's the CDC is where it is.
Okay, then it's CDC.
You also dismantled the Division of Reproductive Health and Women's Health and Fertility. You're aware of that, right?
Right now, we have 42 divisions that do maternal health. It's ridiculous to have 42 divisions that are all supposed to be doing the same thing.
You just heard about the Safe to Sleep campaign, and you have made cuts. You made it very clear here today. You have no knowledge whatsoever of the absolutely amazing scientists and researchers who you have callously fired. You know nothing about the cuts.
You can fire any working scientist, Senator.
That, sir, is not true. You've been unable to answer specific questions. Sir, you are the wrong person for this job. And you had in this hearing today the unmitigated gall to say at the beginning of your testimony that China is ahead of the United States in healthcare because China does not have DEI.
I didn't say that.
Well, we can roll back the tape. You absolutely
And
did
you
say
will
that.
find I didn't say that.
That is absolutely what you said.